Educating your patients and informing them of their health complication is an important aspect of the nursing role. Education, together with coaching conversations, can be a powerful catalyst for health behaviour change and to empower them to make the long-term changes required for sustainable behaviour change. The goals of the care plan are something that you need to work with your patients over time and can be adjusted according to needs.
So Tom, there's a number of health issues that we want to help you manage, and certainly there's the diabetes, there's the lung problems that you're having. We want to help manage your high blood pressure and your high cholesterol. So they all affect each other, so they're all part of the one big picture. We've sort of discussed what the doctor has identified as your big health issue.
Right.
How are you?
Well, the diabetes, now I know, I know my fatness, my weight can affect that, so I know we're going to do something about that. And you're giving me you're going to get me the tester that I'll do once or twice a day, whatever you say.
Yeah.
And eating too. I think I need to eat the right things, but there's other things, isn't there? There's the cholesterol, and that's eating as well, I think. I've got the medication for that.
Certainly taking the medication is very important for managing your cholesterol and your blood pressure.
And the diabetes, I know that I've got to look at my feet.
That's
when I'm in the shower.
When you're drying them.
Oh yeah, and check them out for any problems, and I have to let you know if I find any problems. That's right.
Yep.
And
so what do you think is a reasonable thing? Given we've talked a little bit about what healthy food choices would be, activities and strategies, what would be a reasonable target for you?
What sort of exercise should I do? Should I walk somewhere? Should I say walk around the block?
Yeah. How long does it take you to walk around the block?
I don't walk very fast. 20 minutes.
Okay. Can you do that every day?
I've got plenty of time.
All right.
And I could do it.
Okay, so let's make your first goal that you will walk around the block every day. Okay?
All right, once a day.
Once a day to start with, and then we'll aim to build that up. Is that okay?
Yes.
All right.
I can do that.
What about with the food choices? Can I suggest that the first thing we do is maybe cut out the biscuits? Do you think you can manage that?
Are they all the same? All right, we'll try it.
Let's think about some other snacks that you might enjoy that are healthy. We know that nuts can be quite a good choice.
Yes.
Now that doesn't mean you can get salted cashews and eat them by the bucket load.
Yes, what about...
but a small handful of raw nuts?
Instead, because I eat nut biscuits. Oh.
But we've got to think about your teeth too, so...
Biscuits. Yeah, all right. Okay, well, I can cut down the biscuits.
Okay.
I can cut out the biscuits.
Why don't we just try reducing them?
Right.
And I'd like you to think about changing your bread choice. So I know currently you're eating white bread.
Yes.
But we really need to look at choosing a bread that's going to have a lower glycemic index.
That's got fruit in it.
No, not that it's got fruit in it. That would probably have a high glycemic index.
Okay.
Just something where the energy is going to be released a bit slower. There are some specialty breads, so I'm going to write down the names of them for you, and where you might be able to get them. And maybe we could try replacing your white bread with one of these.
Well, that should be easy.
All right. Does that sound like a plan?
Should be easy, but if it doesn't taste very good, it'll be hard.
Oh, we'll give it a go.
It's important for the patient to understand and agree to the care plan management goals and actions, as well as the treatment and services, including those that may be provided by other collaborating providers. Information may be provided differently for every patient depending on their preference and level of health literacy.
Yes. So I've drawn up a care plan here for you. There's a lot of information and there's a lot of words, but what we might do is just choose from that a few key things that you can work on, and some of them perhaps that you can work on with me. So with the diabetes, there's a number of reviews that we need to set in place for you. It's very important that you see the optometrist and get a diabetic eye check done every year. It's very important that we make sure that your feet are being well managed and are reviewed at least twice a year, certainly once by me, but if I have any concerns with the podiatrist. I think we need to make sure that we're managing your medication. So I think that given the number of medications you're on, we should organise for your pharmacist to come in and sit down with you at home and go through those medications, and then look at any of the over-the-counter products that you might be using.
They do that.
They do that, yeah. So we can set that up for you. The other things that we need to think about doing is getting you to maybe have a follow-up of your lung function test, because I looked through your notes. It's been quite a while since you've had your lungs assessed. When you have chronic disease, it's very important that we make a distinction to see if it's progressing, and also see if there's an asthma component to it.